We're doctors Carlo, Riolo, and Niksich. We're veterinarians and status quo disruptors, and we are Spartans.
The veterinary profession has not grown beyond the business model of the 1990s, while everything around it has changed. You may find some isolated instances of growth and progression, but as a whole, our industry is dated. As we got into practice, we realized we needed to explore solutions to improve patient care and caregiver education, create stronger care teams, and provide a better quality of life for our care team members.
Practice ownership was not originally one of our goals, but as associates we felt our input was often overlooked. We realized that we could more positively impact our coworkers and hopefully our entire profession by operating our own clinic. When we opened PAW Health 4 years ago, we looked at the issues that veterinarians face daily. We started to see patterns within the problems and began generating real-world solutions to address critical needs. We view our practice not as a clinic, but as a movement. Our goal is not to create a better clinic, it's to create a better industry.
We see so much opportunity by embracing change. It's time to move forward, innovate, and create a new foundation from which we can support tomorrow's veterinary professionals. Our clinic's philosophy focuses on mentorship, onboarding, and training at all levels. We also have a focus on replication, a financial and mentee support system for veterinarians wishing to own their own practice. Our current plan is to co-invest into a practice with some of our mentees for a finite period of time to help them get their legs under them, then have them assume ownership of the practice. We will continue supporting them while giving them the latitude to control their investment. We are in this to build leaders, not clinics. The more leaders we build and the more locations we expand into, the more opportunity we have to grow our movement.
We feel that this shift in philosophy is critical because, frankly, it's difficult to be a veterinarian in 2019. Think about the human healthcare crisis today, with expensive protocols, state-of-the-art equipment needs, and higher standards of care. Now imagine very few patients having insurance in that environment, and you have the veterinary profession. We all got into this field because we wanted to help care for patients. Running a successful clinic and having a good quality of life while doing so is extremely difficult without completely rethinking the way the industry operates.
Our profession has some of the worst statistics regarding mental, physical, and emotional health. We graduate school with an understanding of how to practice medicine, but we are not taught how to deal with depression, conflict, and accountability. We don't have good work-life integration, and we're not always positioned for a long and successful career. If we really stand behind our words of support, mentorship, and providing for those who come after us, then it only makes sense that we create solutions at the university level for students and future professionals.
I've been coming to campus once or twice a year lately to connect with students, hold dinner talks, and try to expand their understanding of the profession. The MSU D.V.M Student Success and Wellness Program is the mere beginning for professional students. PAW Health is here to fill in the rest.
All students need more real-world experiences and better tools to equip them for a long, successful, and fulfilling career in this industry. We hope our program will grow over time and that we can positively influence whole generations of veterinarians.
One day we'll stop seeing patients, but if we push to help as many professionals as possible, our influence extends far beyond one exam room in a remote clinic in northern Wisconsin. We are grateful for the education that we gained from Michigan State because it allowed us to critically think about patients, be lifelong learners, and forge a path as leaders in our profession.
Spartans will blaze new trails.